Today's topic is ultrasound image optimization. Coming to the introduction, optimizing ultrasound equipment settings and applications is crucial for patient care because the main critical limitation is that ultrasonic waves cannot pass through bone or air, which limits their usefulness. In addition to having a good understanding of anatomical structures and examination techniques, it is essential to know how to make the correct adjustments to the machine to obtain the best image quality and fully utilize the potential of ultrasound equipment. Coming to the various steps in the image optimization, these 6 steps should be remembered. Coming to the first is transmission power, which is helpful in depth of penetration. This is helpful in depth of penetration, and scattering is also reduced with increasing transmission power. Second is gain, which we will speak in the later slides, and third is frequency. Fourth is depth penetration. Fifth is focal zones, and lastly other settings such as adjusting the dynamic range and different gray maps and or frame rate. Coming to first how to manually boot, that is switch on and off. The ultrasound system can be powered on and off using partial power on off control located in the control panel. Due to complex software functions, the system may take time to boot up or shut down. To prevent any damage or disturbances in the ultrasound systems, do not switch off the power supply while the system is booting or shutting down. Coming to the monitor. The monitor displays the information which is produced while doing the ultrasound exam, and it makes accessible for the user to even review later. The monitor should be positioned to allow the examiner a near perpendicular viewing angle, because an excessive flat angle results in loss of contrast perception. Coming to the transducers, selection of the right transducer is important. First, we have to know different types of transducers. For this, they complement each other and serve different requirements regarding body region, structural representation, depth penetration, and field of view. Differences in geometry, crystal arrangement, and crystal activation make these variations possible. These are the different types of transducers, where in cardiology, cardiac anesthesia will generally used phased array, and curvilinear probe is generally used in gallbladder, kidneys, liver, bladder, uterus, ovaries, and aorta image acquisition. And linear probe is generally used to diagnose DVTs and to view arteries, veins, skin and musculoskeletal systems, even eyes and breast. Coming to convex transducers or curved linear arrays, these are commonly used in abdomen and pelvic sonography. These crystals are positioned alongside a curved surface which expands the field of view, particularly in depth display, while ensuring good resolution in the near field. As a result, the produced image is cone shaped with the diameter increasing as the depth increases. Linear transducers, also known as linear array transducers. In these, the crystals are positioned next to each other in a straight line. This arrangement allows the ultrasonic waves to organized in parallel, resulting higher and more uniform resolution. However, this comes at the expense of depth penetration as higher frequencies are required. As a result, the output image produced by linear transducers is rectangular in shape. Coming to the sector transducers, these are also known as phased array transducers. These use smaller and narrower individual crystal elements arranged in a horizontal or circular pattern. They have a smaller footprint and provide finer control of individual crystal section. By using a slight time and phase offset, Sector transducers create special sound fields, resulting in a fan or pie-shaped image. This type of transducers is more effective than convex transducers for displaying depth and is useful for narrow acoustic windows found in intracavitary sonography, echocardiography, and neurosonography. An important advantage of sector transducers is their ability to apply continuous wave Doppler ultrasound, which is not possible with other types of ultrasound transducers. Coming to gain. All ultrasounds have gain control. It is often a knob, button, or a series of sliders on the control. And it's one of the most used and adjusted scanning parameters. Most people think of gain as brightness adjuster, and while it's true that turning up gain will brighten the image, it's helpful to understand how it actually works. Gain is uniform amplification of ultrasonic signal that is returning to the transducer after it travels through the tissue. So rather than brightening the monitor, the image on the screen is whitened by a uniform margin, as though the returning signal is stronger than it is, to make it easier to see. These are the different images, ultrasound images, showing where the gain setting is low on the far left, coming to high gain setting in the middle one, and the optimal gain setting where you can differentiate the different structures in the right slide. Coming to the time gain compensation. A way to overcome ultrasound attenuation is time gain compensation, in which signal gain is increased as time passes from the emitted wave pulse. This correction makes equally echogenic tissues look the same even if they are located at different depths. It is also known that emitted ultrasound wave amplitude gets smaller as it penetrates tissue, a phenomenon called attenuation. So one might expect late echoes from deep layers to have smaller amplitudes than early superficial echoes, even those layers have the same echogenicity. If the ultrasound image was formed directly by the raw returned echoes, image would appear lighter in superficial layers and darker in deep layers. But this time gain compensation is used to overcome this artifact. These are the knobs which generally are used in time gain compensation. This knobs, which is depicted by the yellow vertical line, corrects varying depths of intensities of the imaging field. And to adjust, first you have to adjust the time gain compensation to decrease in the near field and increase in the far field. And the active mode is overall amplification of the returning ultrasound signal received from all the depths. Coming to the image quality. The image quality depends on several factors. Primarily, the transduction must be adequately coupled to the patient with enough coupling gel to prevent air interposition and ensure all crystals optimal transmission and reception of sound waves. Adequate depth penetration, image width, spatial and temporal resolution, image contrast, artifact suppression, and the application of zoom are relevant to achieving optimal image quality. Coming to depth penetration. Depth penetration influences the size of examination window and the reproduction scale. It depends on transducer frequency, transducer transmission power, and tissue harmonic imaging. Several aspects should be considered when determining depth penetration. High depth penetration is essential for comprehensive view of anatomy but leads to slow image acquisition. Tissue density affects the speed of sound, and increasing depth penetration compromises resolution. This is when high frequency probes are used, which are shorter wavelength, shorter penetration, and gives good resolution. When low frequency probes are used, longer wavelength, longer penetration, and results in poor resolution. As the depth increases, the layer thickness also increases, reducing resolution. A lower depth improves the representation of moving structures and ensures smooth image reproduction during transducer movements. Therefore, the selected depth should be deeper than the structures of interest. Now, other factor is zoom. Zooming on an image using a monitor can help magnify specific section. The zoom function doesn't affect the depth of the image. It relies on the setting of transducer and the maximum range of the ultrasound waves. When a section of image is zoomed in, the echoes from the outside the remaining area do not need to be assessed, which improves the temporal resolution and the density of the image. This is a particle where the image is zoomed, and you can see only that area will be highlighted rather than the surrounding areas. Coming to resolution, there are different types of resolution. Firstly, spatial resolution. The transducer predominantly determines the ultrasound system's ability to distinguish between 2 points at a specific depth in a tissue, known as axial or lateral resolution. In this, axial resolution is axial. It is also called as longitudinal resolution. This is the minimum distance that can be differentiated between two reflector panels to the ultrasound beam's direction. Coming to the lateral resolution, the lateral resolution of an image created by ultrasounds is the minimum distance that can be distinguished between two reflectors located perpendicular to the direction of the ultrasound beam. Lateral resolution is higher when the width of the ultrasound beam is narrow. Coming to temporal resolution refers to time between consecutive frames, representing the ultrasound system's ability to distinguish rapidly moving structures, such as during cardiac cycle. This is the diagram depicting various resolutions, where the first one is the high density of the ultrasound waves near the transducer's yield, which yields in high lateral resolution, and the perpendicular structures represent axial resolution, and the sound waves diverge with increasing distance from the transducer, resulting lower lateral resolution. Coming to sectoral width, reducing the sectoral width will improve lateral resolution by narrowing the acoustic window and can be altered using convex probes. Coming to the brightness, the overall brightness can be adjusted by manually controlling the gain or depth. The time gain control and depth gain control help compensate for weaker amplitudes from deeper layers of the image. In standard settings, the depth compensation works well but may need to be reduced for structure that don't significantly absorb the sound, such as liquids. If a high-end machine is being used, these adjustments are made automatically when necessary. This is where we can see if in narrow sector width, RA seems to get collapsed due to pericardial effusion. The signal gain can also be configured. It controls the image brightness and should be selected so that the structures of low echogenicity, such as liquids, are displayed in black, and highly echogenic structures, such as bones, are in white. If this setting is unbalanced, it will lead to loss of detail due to unused grayscales. When working with exaggerated signal amplification, the sound lobe diameter analyzed by the device increases, but the spatial resolution in the layer thickness plane decreases. Coming to chromatic colors, the human eye has significantly higher resolution in color vision than black and white. Therefore, displaying sonographic images in color gradations, that is monochromatic, or grayscales in different colors, polychromatic, makes sense. This highly depends on examiner's adaptation to the color scheme. Unbiased students prefer the monochromatic display as opposed to experienced ultrasound users who used to black and white images, and thus favors this setting. Thank you.